Hello, happy Friday, everybody. Dr. Amy Ostick here with Health and Healing Direct Primary Care.
And I am Dr. Brian Ostick, emergency medicine specialist.
Yes, you are.
In the Valley.
Yes. And we are going to talk about COVID-19 and the novel coronavirus today. If you would like more information about my practice here in Woodland Hills, Health and Healing Direct Primary Care, call us anytime. We're here for you, 818-600-2426. Or visit us at our website, Health and Healing Direct or healthandhealingdpc.com. Also, Ostick MD is the Facebook page that we also post a lot of information on. And yeah, so what
you're on Instagram and
on
YouTube.
Instagram, and I'm on YouTube.
And if you want to sign up for the practice, you are accepting patients.
I'm accepting patients.
On the website, top right side, little box says sign up.
Correct.
Anna Marie will contact you for further details after you sign up.
Super easy. Would love to explain the model to you. And it's been great. So especially through this this wave, this pandemic, being able to kind of reach people and be more of a resource for community education. What we'd like to talk about today is that I have some good news, and I'm sure you all are probably aware of this.
There's good news to report?
There's good news.
Oh, that's good.
LA County, for the first time in quite a while, has reached lower than 8% case positivity rate.
Does that mean our kids can go back to school yet?
Almost. Almost. So we're at about 6.5%, which is the first time in a long time that we have reached a level below 8% of cases that are being tested coming back positive. And it's one of a few indicators that maybe our community transmission is going down, okay, or more controlled. Our mortality rate is continuing to decline or stay steady, which is also good news. And then the other kind of markers that they are keeping on, that keep LA County on the kind of the quote unquote watch list, our hospitalization rate and also kind of ventilator capacity and ICU bed capacity. So those have been pretty steady and good. It's really the case positivity rate that we've been kind of hovering around 8 to 9% for quite a while. We have to be below 8% for 2 weeks to be considered coming off the watch list. Now, there is a lag in data because we did have some issues with our reporting and the electronic system. So I did see today that the state is holding off on pulling anybody from any watch list until they have more data and then there's more accuracy. So fingers crossed that they'll be able to go back to school in person.
Keep wearing your mask, keep social distancing.
Doing all the things that we're doing, staying away from house parties, all that stuff.
Garcetti will shut you down.
Garcetti will shut you
He
down.
will turn that power off.
That's right. So what I would also get more into today, and our practice actually received our first 100 doses of the seasonal flu vaccine.
That's amazing.
2021.
That's the earliest flu shot I've ever seen arrive here, which is awesome.
Yeah, well, we pre-ordered. We knew in March, April that we wanted to pre-order because we were hoping that there would be a larger demand for it. So now more than ever, Dr. Brian Ostick, it is important to get your flu shot. And it's
important every year.
It's important every single year. It is more important this year than ever. And really the reason is we do not want to see, a flu season with a COVID season together. It would be, from a resource standpoint and a utilization standpoint, a catastrophe.
Right.
You have flu deaths, serious, flu infections, pulmonary infections causing hospitalizations and intubations, and people in the ICU from flu-related complications every year at a high level. We had almost 180 pediatric deaths from flu last year alone.
Well, and flu season is always busier for us in the ER than it is in the summer. Our summers are light season, and flu season in the wintertime is our busy season. And that's true across the board, across the country in terms of emergency medicine. And what's interesting, though, that this year, in the Southern Hemisphere, where the flu season actually hits earlier than us, and that's kind of what they look at to predict how bad our flu season is going to be, is that because of social distancing, because kids weren't in school, they're thinking that maybe the flu season will be a lighter flu season this year, but it doesn't mean that you shouldn't get your flu shot. You should still absolutely, even more than ever, like you said, get your flu shot this year.
Right, and hopefully, right, the same measures that help us protect and mitigate COVID spread also help us to protect and mitigate flu spread. So wearing a mask and social distancing and all that as well. It's also a respiratory virus that's spread via droplet. So that's good. But guess what? We have a vaccine for flu, and we have a seasonal rotating vaccine that in the well-matched years, and this is the sort of shtick and spiel I give to my patients. Everybody says, well, I didn't work for me. I still got the flu. Yeah, it's not 100%. It certainly only protects you from 3, maybe 4 different strains, and not 100%. In a well-matched year, meaning we guessed right? The vaccine producers and the epidemiologists and the infectious disease specialists that go in and recommend which strain should go into the seasonal flu shot, they get it right. It can protect you about 70 to 80% from getting the flu, and certainly flu-related complications like sepsis and pneumonia. Even in a poorly matched year, even when we don't get it right, when everyone says it wasn't right this year, and you start hearing all the media have their opinions about it, it still can protect you about 30% from getting the flu and flu-related complications. And it's not necessarily the mild influenza-like syndrome illnesses that we care so much. It's really the serious infections and the complications, and that's what the flu shot can protect you. It's a little bit of a booster to remind your immune system what's coming ahead, and so that you're amped and ready to go. And this is a similar process that's going through the coronavirus vaccine trials. It's the same type of, they're trying to look to see if giving this vaccine really helps to remind people's immune systems of what that looks like, so that when they're exposed, they maybe don't get it, or maybe get a very mild case.
Cool. How many flu shots did you get?
Got 100 shots, and I got some feedback about, is it too early? Well, here's the spiel. So it should confer about 6 months of immunity, probably longer. It does wane over the course. And we typically, it takes about 2 weeks to develop antibodies to the flu, to the vaccine. So that first 2 weeks you're still vulnerable. So the earlier the better, right? And we can see flu as early as October. I mean, we really can. So we really want to get a big push.
So just get it now, and you'll be protected throughout flu season.
Yes, and we can see a second peak in March, but again, 6 months of immunity, theoretically, it should protect you throughout the whole flu season.
And you're giving out those flu shots for free to new signups, is that right?
I am. Free flu shot for new members to HHTPC, $15 for existing measures. Either way, everybody gets your flu shot. There are very few, probably I can think of not many at all, contraindications to getting flu shot.
No.
It does not give you the flu.
People with an egg allergy sometimes have to be careful. Is that right?
No, monitored. If you have an egg allergy, come in here, we'll watch you, and you make sure, even if it's an anaphylactic severe reaction, it is not a contraindication getting the flu shot.
You heard it here first.
So that's not an excuse. And I mean, and then having a cough or a cold or other upper respiratory symptoms, not a contraindication to getting a flu shot.
Right. And people always say, oh, I got the flu shot last year and then I got sick. I'm not getting it ever again. And that's just not true. The way that would work is that you got the flu shot and then you got some other virus that was a viral syndrome, like parainfluenza or another coronavirus or rhinovirus or adenovirus or one of the other hundreds of viruses that are out there, and you thought it was the flu and it actually wasn't.
Right.
It wasn't the flu shot that gave you the flu.
No, it's pretty much impossible. Scientifically impossible.
Right.
So get your flu shot. If it's not here somewhere, please, we need a huge kind of PR for the flu shot this year, public PR. It's to protect you. It's to protect others. It's to protect our community. And
are you getting your flu shot this year?
I got it.
You already got it. You and Anna Maria both, right?
Yes.
Okay.
To protect the utilization, to protect our resources. This is not it. And similar with masking, there were people weren't doing it because it was more about protecting others, and now there's data that it does maybe protects you too. But this is a community effort here. We're doing it to protect each other. So, flu shot as soon as you can, and keep doing what you're doing because you're doing a great job. LA County hopefully is in the right direction. Hopefully the data will be more accurate in the next couple of weeks, and that we'll be able to get these kids back to school in person where they belong with the people that care about them. And so we
Please.
please, we're begging you. If you need anything, again, please reach out. healthandhealingdpc.com. Dr. Amy Ostick here, always here for you.
And Dr. Brian Ostick, happy to be a part of it. Thanks, Dr.
Thank
Ostick.
you.
All right.
Thanks.
Bye.